What's up, everybody? Welcome, welcome, welcome. Hey, today we are doing NCLEX questions today. We're doing NCLEX questions as we do per usual. All right, per usual. Hey, if you guys are just now joining, welcome. My name is Kevin. I'm a registered nurse. Been a registered nurse for almost 4 years. It'll be 4 years next month. Worked ICU, OR, and PACU. We're going to be doing some NCLEX questions today. So as people start to trickle in here, hey, you already know what I want. Y'all know what I need. I need 1,000 likes. And I need 100 people up in here. What do we think this is? If you are new here, say it, girl. I see you. All right. If you guys are new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. Like I said, I want for you to smash that like button. All right. I need to see hearts in the chat. I need to see hearts everywhere. If I don't have 1,000 likes or 1,000 likes and 100 people up in here, we ain't going nowhere. What's up, city girl? Bree, how are you? Well, today's Friday. It's been one of those days. But hey, it's okay because we're going to make it. We make it through. We all have our days to where we need to make it through, right? It doesn't matter how much you're studying. Doesn't matter what you have going on in life. You got to keep pushing, all right? Hey, but welcome. Hey, welcome. We're about to do some NCLEX questions, all right? Hey, but I need 1,000 likes. If y'all don't want these questions, then I won't give them to you. So make sure you guys share. You have to share, all right? Sharing is caring. Sharing is caring. Hey, a blessed RN is in the building, y'all. A blessed RN is in the building. She is the queen of dosage calculation. All right. She is in the building. So, hey, if you're having a problem with dosage calculation, med math, anything like that, if you're not in nursing school and you're scared of pharmacology and you're scared of how to do dosage calculation, that is your lady. I'm gonna pin her right here. Hey, Miss Lady, how are you? Hey, so if y'all are not following this lady right here, what are you doing with your life? Go follow her. All right. Hey, but shout out to all 75 of y'all. Hey, I need 100 people, at least 100 people and 1,000 likes. And also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What's up, Katie? How are you? Katie, did you change your picture? It looked like you changed your picture. All right. Hey, we got 100 folks up in here. We got 100 folks. So now I just need 1,000 likes. You know what I'm saying? Hey, make sure you guys share. That is the trifecta. All right. The likes, the shares, the follows. That is the trifecta that gets me to the For You page. That's what TikTok wants, baby. Shout out to Bella from Seattle, waiting on that ATT. Hey, just realize that could take anywhere from 2 to 4 weeks. All right. But always, but keep pushing. All right. What's up, Love Darley? How are you? Hey, we're almost to 1,000 likes, y'all. Almost to 1,000 likes. Get carpal tunnel for me. Stop playing games. All right. Hopefully everybody's ready for the weekend. All right. Everybody's ready for the weekend. Hey, have a little downtime with the family or whomever you want to spend that time with. All right. But here we go. Shout out to y'all. Here we go. Question, not the carpal tunnel. You already know what's up. Here we go. Question number 1. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? A high fever, a non-productive cough, rhinitis, or vomiting and diarrhea? What do we think it is? Go ahead and drop your answers down in the chat. Like I said, make sure you guys like, you guys share, and you guys follow. Hey, we're on the road to 10,000 likes. We're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, well, I guess y'all just getting 10 questions on Friday. What is it? It says, thinking of getting my license. I don't know if I would pass. Well, you'll never know unless you try. If you count yourself out before you even go, don't even go. If you count yourself out before you even remotely even try it, don't go. All right. But you need to ask yourself, hey, if I want to be a licensed, first thing you need to ask yourself is why? Why do you want to be a nurse? Because nursing is not easy. It's not easy. All right. Bedside, people spitting on you, cussing you out, family members cussing you out. You want to be a part of that? You know what I'm saying? But hey, it's rewarding when you get sick people, back to their norm. I'm just saying, I'm just keeping it all the way real. So you need to realize if you decide you want to do nursing, what is your why? That's what I ask everybody. But here we go, y'all. Here's our answer in 3, 2. And the answer indeed is high fever. All right. If the child has bacterial pneumonia, a high fever is usually present. All right. Increased temperature or fever with tachycardia and or chills and sweats is a major clinical finding. Physical findings also vary from patient to patient and mainly depend on the severity of lung consolidation and the type of organism, the extent of the infection, host factors, and existence or non-existence of pleural effusion. That's part of physiological integrity. All right. Physiological adaptation. All right. That's the third largest section on the NCLEX exam at 11 to 17%. Oh, you've been a nurse for 40 years. My bad. Hey, but I tell you, same thing to everybody. And if you're trying to do something new, so shout out to you, Kathleen, for your 40 years. I'm not even 40 yet. I don't know how that makes you feel. That's all love, though. All right, but that's physiological adaptation. All right, physiological adaptation, third largest section on the NCLEX, 11 to 17%. Okay, so if you don't understand that, you need to go back and you need to get that content. Take a look and understand what the questions are. Once you understand what the questions are, you'll know what section that they come from. Okay, here we go. Question number 2: the nurse is caring for a client admitted with epiglottitis. Epiglottitis. It says, I teach nurses at university. Shout out to you, Commander. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Is it intravenous access supply, a trach set, IV fluid administration pump, or supplemental oxygen? What are we thinking? Somebody's saying it's definitely B. Hey, if you guys are wondering, I got these questions off of nurseslabs.com. Nurseslabs.com. They are free sets of questions. You guys can go over there. You guys can check those out for yourself. Okay. So, hey, this is where I get them from. The whole thing is to get you guys into a routine, you guys and gals. All right. To get you into a routine of studying. All right. Get you in a routine. I do this Monday, Wednesday, Friday at 5:30. Right. So if you can come here at 5:30, or watch Bridgerton whenever it comes on, you know what I'm saying? Hey, you can schedule out your time for yourself to study. Hold on, what did Eric say? Eric said something. What do we think? But anyway, the answer is definitely B. All right, it's definitely B. For a child with epiglottitis and the possibility of complete obstruction of the airway, emergency tracheostomy equipment should always be kept at the bedside. Prepare for intubation or tracheostomy. Anticipate the need of an artificial airway. An artificial airway is required to promote oxygenation and ventilation and prevent aspiration. That's part of, it's under safe and effective care, right? Which is part of physiological adaptation. All right. Called you out. What you mean? What do you mean? I ain't call nobody out. Anyways, physiological adaptation. All right. Also known part of a medical emergency. All right. 11 to 17% on the NCLEX exam. All right. So shout out to y'all. All right. Shout out to y'all. Here we go. Question number 20 or 25. Question number 3. A 25-year-old client with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Would it be bradycardia? Would it be decreased appetite, exophthalmos, or would it be weight gain? All right. This is understanding those disease processes. All right, just understanding your disease processes and how they affect the body. All right. Hey, if you guys are just now joining, welcome. We are doing NCLEX questions. I got them off of nurseslabs.com. A lot of people ask me, how do they feel? Or a lot of people ask me what Q banks that I recommend. The ones that I recommend, if you were to buy straight up questions, would be Kaplan, UWorld, and Archer. All right. Those would be the question banks that I would recommend. All right. But let us see what the answer is. But understand what Graves' disease is. All right. Understand what Graves' disease is. Shout out to you, Ashley, taking your NCLEX on Wednesday. All right. Cool. So on Tuesday, we're not doing nothing, right? We're not doing nothing. We're just going to sit and chill. And we're going to try to chill as much as possible. All right. There you go. It says Archer Gang, it's cheaper, and I'm still broke, a new grad. Trust, it doesn't matter. You're going to be broke for a while. It's all good, though. It's all good. But the answer, indeed, is C. It's exophthalmos, right, which is the protrusion of eyeballs. Often occurs with hyperthyroidism, all right? So Graves' disease is caused by inflammation, cellular proliferation, and increased growth of extracellular muscles and retroorbital connective and adipose tissues due to the action of the TSH, right? Or the thyroid stimulating hormones, antibodies, cytokines released by the cytotoxic T lymphocytes. Okay. These cytokines and thyroid stimulating antibodies activate periorbital fibroblasts and pre-adipocytes, causing synthesis of excess hydrophils or GAG and retroorbital fat growth. That's part of physiological integrity, physiological adaptation, because we're talking about a disease process and how it affects the body. Tina says, how long do you think I should study for NCLEX? Tina, that's a loaded question because I have no idea where you are in your studying. So are you a graduate? Did you just graduate? Are you still in school? Did you fail NCLEX? You know what I'm saying? But if you really want me to give you a good roundabout, 4 to 6 hours for at least 30 days, if that's what you want. But if you want it to be more finite, it all just depends on you. How many questions we do is live? Anybody have idea? What? Is it pre-it or pre? Can you restate that? Can you restate that? All right. But anyways, make sure you guys understand. Make sure you guys understand where your questions are coming from. Okay. Here we go. Question number 4. Question number 4. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. All right. Which of the following foods, if selected by the mother, would indicate her understanding of the dietary instructions? Would it be ham sandwich on wheat toast, spaghetti meatballs, hamburger with ketchup, or a cheese omelet? Is this a Kaplan question? This is a question from nurseslabs.com. So is it a Kaplan question? No, it's from nurseslabs.com. All right. So what do we think it is? Shout out to all 65 of y'all. Hey, if you guys are new here, welcome. My name is Kevin. I've been a registered nurse, BSN, if you really care about that. It'll be 4 years next month. I worked ICU, OR, and PACU. And I was in the Navy for 16 years. And I also failed my NCLEX, y'all. I failed my NCLEX. I failed it 3 times and I passed on the 4th. I even wrote a book about it, which is coming out on June 5th. And so one thing I'm going to tell you is that it doesn't matter how many times you take this exam. It doesn't matter what you got going on. Get out of your own way and pass that exam. Understand what you didn't do well on and you tackle it. All right. Make sure you understand what you didn't do. Hey, get that performance breakdown and look at it if you failed. All right. When you guys are studying your questions, look at those areas of if it's pediatrics and spend a little bit more extra time looking at content there, so on and so forth. All right. But the answer is D. It is a cheese omelet. All right. A child with celiac disease should be on a gluten-free diet. When a child has celiac disease, gluten causes the immune system to damage or destroy villi. All right. Villi are the tiny finger-like tubules that line the small intestine. All right. The villi's job are to get food nutrients to the blood through the walls of the small intestine. If villi are destroyed, the child may become malnourished. No matter how much he or she eats. This is because they aren't able to absorb the nutrients. Complications of the disorder include anemia, seizures, joint pain, thinning bones, and cancer. That's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right, 6 to 12% on the NCLEX. Remember, there are 8 client needs sections. All right, there are eight client needs sections. 6 to 12% is small, but it's still very much important. All right, so very, very much important. All right, so make sure if you don't understand that, you circle back and you get that, okay? Question number 5, the nurse is caring for an 80-year-old with chronic bronchitis. All right, upon the morning rounds, the nurse finds an O2 saturation of 76%. Which of the following should the nurse take first? What is the very first thing that I do upon seeing an O2 saturation at 76%? Is it notify the provider or physician, recheck the O2 sat in 15 minutes, apply oxygen, buy mask, or assess the pulse? What are we thinking? What are we thinking? Now, also, I want everyone to remember, all right, we have a lot of people that come into these lives in and out. And a lot of people don't know specifically because a lot of people just now decided that they wanted to be a nurse. So they wanted to try to understand. Right. So if you are one of those people who has gotten through nursing school or been a nurse, realize where you were. All right. Because when some people come in here and they answer, don't stifle them. All right. This is a learning environment. All right. And we meet everybody where they are. OK, so here we go. All right. And the answer is to apply oxygen by mask, right? This is indeed a safe place. I would rather you get it wrong here than not say anything to anybody and then go and take your exam and then, potentially fail it just because the fact that you feel like you can't reach out to somebody. All right. So remember the ABCs when answering this question. So administer oxygen first to increase the O2 saturation, provide humidified oxygen as ordered. After administering humidified oxygen, humidified oxygen prevents drying out the airway, decreasing convective moisture loss, and improves compliance. That is part of physiological adaptation, and it's also part of management of care. So what is the very first thing that I want to do? You're welcome, Darley, or Cut and Kevin, get into the, hey, listen. You listen, don't come over here messing. Hey, don't come play with me, all right? Because I will block you. I enjoy it, actually, but I think TikTok doesn't like it when you block people. But I care what TikTok wants. Anyways, remember, when you guys are answering questions, all right, you have to read your rationale. RTFQ, RTFA, and RTFR. Out of the 65 of y'all that are here, who knows what that is? Let the new people know what that means in the chat, all right? But of course, if you're new here, or even if you're not new here, if you have not picked up my test taking tips to conquer the NCLEX, what are you doing with your life, all right? I'm gonna need for you to go over there. Queen Minnie, what's up? Read the MF. And, first of all, ma'am, there's no M there. But I got you, though. Or Eric, I'm sorry. I got you, Eric. I got you, right? There's no M there, sir. All right, hey, but make sure you guys go over there to get those test-taking tips to help you conquer the NCLEX. Hey, we're in the middle of NCLEX season, all right? NCLEX season is high all the way to July. You'll see what I did there? All right, go get that free download, all right, thebootnurse.com/test, or you guys can check that link in my bio. All right, check the link in my bio. It'll take you there. You download it, get emailed to you, all that good jazz, all right? Here we go. Question number 6. It says he meant that, didn't I? Didn't. Yeah. He did mean that. Here we go. Question 6. A gravida 3 para 0 is admitted to the labor and delivery unit. All right. The doctor performs an amniotomy. Which observation would the nurse be expected to make after the amniotomy? Is it the fetal heart tone of 160, a moderate amount of straw-colored fluid, a small amount of greenish fluid, or a small segment of the umbilical cord? What are we thinking? We need the prayers. Hey, you already know. We need prayers, but we need work. You got to work. Like if you pray and you don't put in no work, how do you expect to get any results? You got to work. All right. You got to put in the work. Shout out to all 66 of y'all. We're on the road to 10,000 likes. If I don't have 10,000 likes, I guess y'all are just getting 10 questions today. All right. So understand, it says pray without work is dead. Let them know. Amen. Hey, there's a reason why her name is a blessed RN, because she tells us that we all blessed out here, but we got to put in the work. All right. So understand, what is a normal fetal heart rate? Understand what is in the key word here. Listen, let's read. We're going to read this question one more time. All right. The gravida 3 para 0 is admitted to the labor and delivery unit. The doctor performs an amniotomy, right? Now, which observation would the nurse be expected to make after that procedure? After that procedure. And if you don't know what this procedure is, after this, I suggest that you go and you look it up. I don't know why, but I'm thinking D. Oh, I'm thinking B. Go with your gut answer and let's see. Let us see what the answer is. And the answer is B. All right. The answer is B, a moderate amount of straw-colored fluid. All right. And amniotomy is an artificial rupture of membranes, and normal amniotic fluid is straw-colored and odorless. All right. Successful rupture of membranes most commonly is determined by the immediate return of the amniotic fluid from the vagina. All right. This fluid usually is clear and odorless. Hey, that's what I'm talking. Whoop, whoop. Tamara, shout out to you. Physiological integrity. All right. Physiological adaptation. All right. Third largest section on the NCLEX at 11 to 17%. So shout out to all 70 y'all. Okay. Learning. That's what I'm saying. Is it Janilda? Janilda. Tell me your name is Janilda. It's like Matilda, but Janilda. Janailed it. All right, I'm done. Here we go. Question number 7. The client is admitted to the unit. A vaginal exam reveals that she is 2 centimeters. Yes, I got you. 2 centimeters dilated. Which of the following statements would the nurse expect her to make? All right, so we're 2 centimeters dilated. All right, ladies, all the ladies that are out there, if you guys have had kids, you kind of already know the answer. All right, you kind of already know the answer. All right. So what question would I expect for this mother who's about to give birth, who's 2 centimeters dilated? What would I expect for her to ask me? We have a name picked out for the baby. I need to push when I have a contraction. I can't concentrate if everyone is touching me or if anyone is touching me. Well, please don't do that. Don't be punching people. You know what I'm saying? And when can I get my epidural? What do we think it is? I don't know if y'all saw that story where a lady was just like, I was in labor, don't touch me. The nurse was trying to take care of her, like her IV or something was going on, and she punched the nurse. Hey, let me tell you something right now. Don't do that. Do not do that. She's like, it's part of my birthing plan. Yeah, well, part of your birthing plan is not me whooping your ass. All right, here we go. Hey, I'm just playing. But the answer is, when can I get my epidural? All right. When can I get my epidural? Dilation of 2 centimeters marks the end of the latent phase. All right. Right. Listen. So when you guys are going back and looking at the stages and phases of labor, this is where you're going to get your answer. All right. So during the latent phase, the cervix dilates slowly to approximately 6 centimeters. The latent phase is generally considered longer and less predictable with regard to the rate of cervical change that is observed in the active phase. A normal latent phase can last up to 20 hours and 14 hours in the nulliparous or multiparous woman, respectively, without being considered prolonged. Physiological integrity, adaptation, 11 to 17% on the NCLEX exam. All right, on the NCLEX exam. All right, it says D was the only question. The rest were statements, and that's another technique. All right, that's another technique. I'm not cutting up. What are we talking about? Hey, listen. I'm out here giving love and knowledge. That's what I like to do. Darling, you are welcome. All right, but shout out to y'all. If y'all don't understand that, go back and look it up. Go back and look up the different stages and phases of labor. All right, and honestly, which ones make more sense? All right, here we go. Question number 8. The client is having fetal heart rate of 90 to 110 beats per minute during the contractions. The first action the nurse should take is what? Reposition the monitor, turn the client to her left side. All right. Ask the client to ambulate or prepare the client for delivery. What do we think? All right, we got A, asked me, have I heard of Remar? Of course I've heard of Remar. Miss Regina Callion. All right, I got a bunch of people screaming B. Hey, if you guys are just now joining, we're on the road to 10,000 likes. We are on the road to 10,000 likes. If you guys are new here, welcome. We're doing NCLEX questions. These are both for RNs and PNs, all right, from nurseslabs.com. You guys can get those for free. They're free sets of questions over there at nurseslabs.com. Go check them out for yourself. But I want to know who you are, where you're from, and where you are in your nursing journey. That's what I want to know. I want to improve circulation by mom off the aorta. Okay, so what do I want to do for that, Katie? I don't know if I saw your answer, but what do I want to do for that? I'm from Nepal. Shout out to Nepal. That's where Mount Everest is at. That's all I really know. Please educate me on some more. Alicia from Jamaica. Shout out to Jamaica. Princess SRB from West Texas. Shout out to all my Texans. I live in Texas too. All right, Katie's telling me B. Look, Katie, you got it right. I'm from Cali. You're from Cali, California. Shout out to you. All right, so the answer is B. Turn the client to her left side. All right, the normal fetal heart rate is 120 to 160. All right, 100 to 110 is bradycardia. The first action would be to turn the patient to the left side and apply oxygen, right? A slow heart rate or bradycardia may indicate that, the baby is not getting enough oxygen delivery to the brain. A fast fetal heart rate or tachycardia may indicate oxygen deprivation, all right? There is an acceptable range of acceleration and deceleration or speeding up and slowing down of fetal heart rates during contractions and labor. Physiological integrity, physiological adaptation, 11 to 17% on the NCLEX exam. So shout out to y'all. Shout out to y'all for getting that answer right. All right. Shout out for y'all to getting that answer right. Y'all got me to 10,000 likes. I love it. I love it. All right. Now let's go to 20. Let's do it right now. Let's do it. Katie, get carpal tunnel for me right now. Let's make it happen. Here we go. Question number 9. In evaluating the effectiveness of IV Pitocin for a client with secondary dystocia, the nurse should expect what? So what should I expect when I give a patient Pitocin? All right, secondary to dystocia, right? Is it a painless delivery, cervical effacement, infrequent contractions, or progressive cervical dilation? What are we thinking? Hey, if you guys are just now joining, welcome. We're on the road to 20,000 likes. We're on the road to 20,000 likes. All right. No, you know what? We're on the road to 15,000 likes. Let's do that. How about that? I'll let up a little bit. Alyssa is telling me D. All right. Shout out to you, Alyssa. All right. Is it D? I don't know. We're finna find out. Sir, that's not even a letter that's on here. It's not a letter choice. What are we doing right now? That's not even close to the keyboard. You need 20K? Okay, cool. Let's go to 20K. You said it. Let's make it happen. No diddy. No diddy, sir. No diddy. All right, here we go. Y'all. Here's our answer in 3, 2, and the answer is no diddy. I mean, it's D. Y'all are funny. Progressive cervical dilation. All right, progressive cervical dilation. Definitely not painless delivery. Definitely not, Danny. Definitely not. The expected effect of Pitocin is cervical dilation. All right. Oxytocin is indicated and approved by the FDA for 2 specific timeframes of in the obstetric world, antepartum and postpartum. And the antepartum period, exogenous oxytocin is FDA approved for strengthening uterine contractions with the aim of successful vaginal delivery of the fetus. All right, physiological adaptation under physiological integrity, 11 to 17% on the NCLEX exam. All right, third largest section, LPNs. You guys learned the same content that an RN nursing student, candidate, graduate will learn. You just need to know what you can and cannot do and what you can and cannot accept. All right. So make sure you guys understand that. Shout out to y'all. Here we go. Question number 10. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions at this time? All right. Anticipate the need for a cesarean section. Apply the fetal heart monitor. Place the client in the genopectoral position, or perform an ultrasound exam. What do we think? Well, we got a B. We got a A. Danny's telling me A. Shout out to all 76 y'all rocking. We're doing NCLEX questions. Like I said, if you're new here, I want to know who you are, where you're from, where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What are you doing here hanging out? All right. A little bit about me. I've been an RN BSN for almost 4 years, if that really matters to you. I worked ICU, OR, and PACU, as well as I was in the Navy for 16 years, and I failed my NCLEX, y'all. I failed my NCLEX 3 times. All right. And let me tell you something right now, your parents, your patient will never ask you. And the people that you work with, they'll never ask you either. Ever. They'll never ask you because it doesn't matter. No one cares. No one cares how many times you failed that exam. I just need to know, can you perform safely? Safe nursing care, nursing competency. Can you do that? All right. And the NCLEX, hindsight's 2020 for somebody who's failed, but it is basic of the basic. You need to understand everything. ABCs is not always first. ABCs is not always first. It really just depends on what the question is asking you. But ABCs is good and ABCs is true, but it's not always first. All right, here we go. So I want to apply that fetal heart rate. So applying a fetal heart monitor is the correct action at this time. All right, fetal heart sounds are heard high in the abdomen in breech presentation. All right. Be certain to monitor the fetal heart rate and uterine contractions continuously to detect fetal distress early and provide prompt intervention. All right. Action. There are words. There are those words that you need to pay attention to. You're welcome. Is it PASS? I need another name. Give me your real name. Give me your government name right now. All right. Physiological integrity. All right. Or physiological adaptation, which is 11 to 17% on your NCLEX exam. Hey, Megan, Megan, your jacket. Shout out to you. And Mia, all right, Mia with the fish. It means not me. Listen, I don't know what that means. I know what Megan is. You know what I'm saying? So shout out to Megan, shout out to Mia. All right, cool. All right, hey, but remember with physiological adaptation, that includes acute traumas, chronics, disease processes, how they affect the body, and medical emergencies. All right. That's what and trust me, somebody that's having a breaching presentation is something that really is a part of it. It catches your attention. You speak French. Cool. Shout out to you. I'm going to learn a different language one day, just not today. All right. But test taking tips, y'all. If you have not gotten you those hey, that's 42 pages. It used to be one of my ebooks. That's 42 pages of test taking tips. All right. Certain words to look out for, right? Labs to know, all that good jazz. And you get it. And it's totally free. All right. Go over there and get it. Hey, send that link to somebody else. You know what I'm saying? So that way they can get this knowledge as well. All right. So, hey, listen, you get everything but the kitchen sink and that fanny pack. Just saying. All right. So make sure you guys go over there and you guys get that. You're back. Oh, Lord, have mercy. Hey, y'all. Famous Amos is here. She's here again. Okay. All right, here we go. Question number 11. A vaginal exam reveals that the cervix is 4 centimeters dilated with intact membranes and a fetal heart tone rate of 160 to 170 beats per minute. The nurse decides to apply an external fetal monitor. The rationale for this implication is What? What's the rationale? What's the reason for us doing that, for applying an external fetal heart monitor? Like the cervix is closed, the membranes are still intact, the fetal heart tones are within normal limits, or the contractions are intense enough for insertion of an internal monitor. What do we think it is? I'm still waiting to meet and greet in Boca Raton. Oh, in Boca. Oh, so I actually found out something about Boca today. So it's probably going to get moved, but we'll have to wait and see. And I wasn't going to necessarily do a meet and greet. I was already going to be there for another type of event. So it wasn't going to be a meet and greet. If it was going to be a meet and greet, it would have been very last minute and would have been very impromptu. Trust and believe me. Katie's telling me B. All right, Katie, well, we finna find out. We finna, F-I-N-N-A. If you guys are just now joining, welcome. We're doing NCLEX questions for RNs and LPNs. RNs and LPNs, or LVNs. LVNs and LPNs are the exact same. It just depends on where you live, and that's what they call them. Trust, they're the same. They are the same person. But the answer is B. The membranes are still intact. All right. The nurse decides to apply an external monitor because the membranes are still intact. All right. The test is used to determine if the fetus is at risk for intrauterine death or neonatal complications, usually secondary to high-risk pregnancies or suspected fetal hypoxemia. The frequency of use is based on clinical judgment, but is common because it is a non-invasive and presents a low maternal and fetal risk. However, the test does not hold predictive value and only indicates fetal hypoxia at time of the test. All right, that's physiological adaptation. Physiological adaptation. All right, 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX. All right, it says, good job, B voters. I wasn't one. That's okay. You don't like this question, Katie? It's not about the fact of you liking it. You still got it right. But even if you got it wrong, remember, this is part of your preparation while you guys are studying, right? It's part of your preparation. I saw a question up here. Let me go back. Let me see if I can find it. So is it Kia Cherie? You said affected LOC comes before ABCs. So it depends. It truly depends on what the question is asking you. All right. So yes, if I go into a room and I talk to somebody and then they start telling me something wild, like scorpions are on the floor, I'm going to be like, I'm sorry, what? What do you mean scorpions are on the floor? You weren't like that 5 minutes ago when I came in here. So that's telling me that there's a cognitive issue that's happening, right? There's something like, are you oxygen deprived? Are you not having enough circulation, right? Are you fidgeting? Are you agitated? Are you irritable, right? So remember, look at your patient before you ever look at a machine. It's patient before paperwork, patient before equipment, all right? So that's why I say look at those things, because you could tell somebody's altered level of consciousness can tell you if they're having an airway, breathing, or circulation issue, all right? Who is that? Who gave me a real mace? The real mace? Okay, cool. Appreciate the rose. Thank you. Cool, Kia. Gotcha. All right, here we go. Question number 12. Question number 12. The following are all nursing diagnoses appropriate for a gravida 1 para 0 in labor. Which one would be most appropriate for the prima gravida as she completes the early phase of labor? All right. Is it unimpaired gas exchange related to hyperventilation, alterations in placental perfusion related to maternal position, impaired physical mobility related to fetal monitoring equipment, or potential fluid volume deficit related to decreased fluid intake? What do we think? What do we think it is? Now think about this. All right. Think about this patient all as a whole. All right. They're in the early stages, or they're in the early phase of labor. All right, they're in the early phase of labor. Think about a vaginal delivery or even a C-section, right? Because every mom, every woman in labor has the potential of going to surgery, right? Everybody has that potential. So what do we not allow them to do? What do we not allow moms to do? Katie's telling me D. Think about that. You have to think about the patient as a whole, right? Think about the patient as a whole. All right, D, intake, okay. We got B's, we got C's. Was that 808 grown? What's 808? Isn't 808 like Hawaii? Isn't that Hawaii? Let me know. All right, here we go. And the answer is D. Look at that. Look, I know Hawaii. The only reason I remember it is from that Ludacris song talking about how he got, different friends in different geographical locations. But the answer is D, potential fluid volume deficit related to decreased fluid intake. All right. So clients admitted in labor are told not to eat during labor to avoid nausea and vomiting. Ice chips may be allowed, but this amount of fluid might be sufficient to prevent fluid volume deficit. All right. Provide clear fluids. All right. And ice chips are permitted. It helps promote hydration and may provide some calories for energy production. That's physiological integrity. Adaptation, 11 to 17% on the NCLEX exam. Yes, they are MPO. Yes, they are MPO. Yes, they are MPO. And so that's why we give them IVs. Exactly. That's exactly why you give them an IV. All right. That's exactly why you give them. Remember, they're in the early stages of labor too, right? But then what happens when anybody comes in who's in the early stages of labor? One of the very first things that you're dropping is you're getting mom in bed, getting her nice and comfortable and everything. And then one of the first things that you're doing is giving mom an IV. All right. And they're always MPO because we have no idea what's going to happen with mom. All right. We don't know how the pregnancy is going to go. And she definitely needs to be MPO just in case she has to go for a C-section. All right. That's why those things are super important. OK, here we go. Question number 13. As the client reaches 8 centimeters dilation, the nurse notes late decelerations on the fetal monitor. The fetal heart baseline is 165 to 175 with variabilities of 0 to 2 beats per minute. What is the most likely explanation of this pattern? The baby is asleep. Does the baby ever go to sleep? Let's just be real. Pregnant moms, am I right? Umbilical cord is compressed. There is a vagal response. There is, the utero-placental insufficiency. Veal chop. Look at you. Okay. Veal chop. Who is that? Karishma. Thank you for the share. I think you shared. Thank you for that share. All right. So what do we think it is? Shout out to all 69 of y'all. No diddy. Anyways, shout out to all 69 of y'all out here rocking. We're doing NCLEX questions. Y'all got me to 15,000 likes. I appreciate y'all. For that. All right. But I want to know, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. And here we go, y'all. Let us see what the answer is. All right. Let us see what the answer is. And 3, 2. By the way, if you took NCLEX this week or within the last, 2 days, let me know. I want to give you a shout out. Shout out to everybody that's graduating. Y'all are graduating all month. All right. Hey, come here. We congratulate everybody and all the steps that they're making towards becoming a nurse. All right. And beyond that. So shout out to every single one of y'all that are graduating, who have already graduated and who are about to graduate. All right, here we go. But the answer is D. There is utero-placental insufficiency. I graduated in November. Shout out to you. Mace. Is it Macy or Mace? Because every time I say Mace, I start thinking about, Mace and Diddy. No Diddy. I'm new in New York. I'm in my final semester of nursing school. Shout out to you, Macy. Damn, I even studied this yesterday. Look at you, Katie. Oh, like Mason. Okay. And the game ain't the same since I've been around. All right, you're from New York. You better know that song. This information indicates a late deceleration. This type of deceleration is caused by utero-placental lack of oxygen. All right, late decelerations are one of the precarious decelerations among the 3 types of fetal heart rate decelerations during labor. All right. They are caused by decreased blood flow to the placenta and are significant in impending fetal acidemia. All right. Meaning not enough blood to baby. Baby's going to be like, hey, bro, what's going on here? Fix this. All right. Physiological adaptation, 11 to 17%. On the NCLEX exam, making it the 3rd largest section on the NCLEX exam. Alyssa graduates in 38 days. Shout out to you. Darla graduates in 19. Super proud of y'all. Hey, in those times, I expect for y'all to come back here and be like, Kevin, oh my God, I passed. I'm like, good. Congratulations. I graduated. I'm like, yes, that's what I'm talking about. All right. So shout out to y'all. Here we go. Question number 14. The nurse notes variable decelerations on the fetal heart or the fetal monitor strip. The most appropriate initial initial, meaning first, what is the most appropriate initial action would be to what? Notify the doctor, start an IV, reposition the client, or adjust or readjust the monitor. What do we think it is? What do we think it is? All right. See. All right. Shout out to y'all. Shout out to y'all. Hey, it's the weekend. You know what I'm saying? I want everybody that lion, what is it? A left side, IV, O2, notify, right? Left side, IV, O2, notify the doctor. Oops, you did it again. Shout out to you, Danny. See, Mr. Kevin Pickett. Oh, okay. Well, look, it's already there. It's already there. You know what I'm saying? I just got to hit the arrow and then it tells me which one it is. All right. And it is C. Indeed, it is C. All right. So reposition the client. The initial action by the nurse observing a late deceleration should turn the client to the side, preferably the left side. Administer oxygen is also indicated. Initial management of recurrent variable deceleration should have a target of relieving potential cord compression. Paternal repositioning is a reasonable first maneuver. All right. Variable decelerations can be seen resulting from fetal movement if the fetus is premature. Physiological integrity, adaptation. All right, 11 to 17% on the NCLEX exam. That's the third largest section. All right, I'm telling you, they can take all of these sections and put them together. All right, it's not hard for me to make a management of care question with pediatric clients. Oh, it's a pediatric client, but I need to know which ped client I see first. So there's peds and there's management of care. All right, these are all put together. So you have to, once you understand how they are put together, it's like it's no new news. Okay, it's no new news at all. Right. So shout out to y'all. Here we go. Question number 15. All right. Which of the following is a characteristic of a reassuring fetal heart rate pattern? Is it a fetal heart rate of 170 to 180, a baseline variability of 25 to 35, ominous periodic changes, or acceleration of fetal heart rate on fetal movement? What do we think it is? What do we think it is? Everybody's telling me D. Y'all so smart. Y'all so smart. Shout out to y'all. Shout out to y'all. All right, y'all. Let us see what the answer is. All right. Let us see what the answer is. And the answer is D. The answer is indeed D. Acceleration of fetal heart rate with fetal movement. All right. Acceleration with fetal movement are normal. All right. It's just like if you were going outside and I told you to go run, or if I told you to walk, you know, your heart rate's going to increase, right? Acceleration are transient increases in the fetal heart rate. All right. They are usually associated with fetal movement, vaginal examinations, uterine contractions, umbilical vein compression, fetal scalp stimulation, or even external acoustic stimulation. The presence of accelerations is considered a reassuring sign of fetal well-being. That's physiological adaptation. 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX. All right, so shout out to each and every one of y'all that got that question correct. Ladies and gentlemen, hey, if you're new here and if you have not gotten that 42-page PDF that I have, what are you doing with your life? Hey, go over there and go get that. Go get that right now. It's 42 pages. I don't know how long it's going to be there. I'm just keeping it a stack. I think that's what the kids say, keeping it in a stack, or gang, whatever. Anyways, go over there and get you that. All right, go get you that PDF, 42 pages. It used to be one of my PDFs. Now it's not. Yes, it's 42 pages, like dead ass, as the kids say. I guess. I think that's what the kids say. I don't know. You already know how I feel about these kids. All right. So make sure you guys go over there and get that out. And if you don't get to the website, you can go check my link tree and my bio, and it has everything that I have over there. So it says, y'all mash that like button, or he's stopping at 20. Actually, yeah, you're right. I am going to stop at 20. Here we go. Question number 16, the rationale for inserting a French catheter every hour for the client with epidural anesthesia is why? All right. It's given millennial straight up. I'm a straight millennial. I was born in 87. That's what I do. All right, the bladder fills more rapidly because of the medication used from the epidural. Her loss of consciousness is such that she is in a trace-like state. The sensation of bladder filling is diminished or lost, or she is embarrassed to ask for the bedpan that frequently. What do we think it is? All right. What's the whole purpose? Think about it. If you don't understand what an epidural is, right? Talking about anesthesia, epidural, right? Talking about taking away the loss and sensation from essentially from the lower back all the way down, right? So if I'm going to take away sensation from the lower back all the way down, what do you think? How do you think I'm going to fill my bladder? I probably won't. That's right. You're right. That's why I probably won't. Ooh, somebody said something naughty and TikTok didn't like that. Actually, I didn't like that and I probably blocked it. So here we go. And the answer is C. The sensation of the bladder filling is diminished or lost. Epidural anesthesia decreases the urge to void and sensation of a full bladder. A full bladder will decrease the progression of labor. Under the influence of epidural anesthesia, patients may not feel the urge to urinate. All right, they may not feel the urge to urinate, which can result in urinary retention and bladder over distension. Overfilling of the bladder can stretch and damage the detrusor muscle. All right, so for example, the use of a lumbar epidural anesthesia for labor and delivery has frequently been implicated as a causative factor for postpartum urinary retention. This is supported by the fact that these patients demonstrate a difficulty voiding. Physiological integrity, adaptation. Physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section. When does he come on and what days? Actually, you could have just asked me that. But okay, no, I got you. Monday, Wednesdays, and Fridays at 5:30 Central Standard Time. Yeah, so 6:30 Eastern Time. Yep, there you go. So shout out to everybody who got that right. Circle back. All right. And by the way, if you're new here, I want you to smash that like button. I need for you to share. I need for you to follow. That's the trifecta that TikTok needs. I don't care if TikTok is leaving, it's still here and we still utilizing them. You know what I'm saying? So I want to know who you are, where you're from, and where you're at in your nursing journey. All right, here we go. Question number 17. A client in the family planning clinic asked the nurse about the most likely time for her to conceive. The nurse explains that contraception is most likely to occur when estrogen levels are low, the luteinizing hormone is high. Listen, I'm a nurse, not a spelling bee champ, okay? The endometrial lining is thin or the progesterone level is low. What are we thinking? Shout out to all 73 of y'all. We're out here rocking, doing NCLEX questions. These are both for RNs and LPNs. You guys can go to nurseslabs.com, nurseslabs.com, and you guys can go over there and check those questions out for yourself. They're free sets of questions. All right, free sets of questions. Hey, I got some stuff coming up for y'all next week. Got a surprise. So I got a surprise for some of y'all. I got a surprise. North Carolina going to my second semester med-surg. Shout out to you. All right. For the good old of the med-surg. All right. But the answer is B. What is it? Luteinizing hormone released from the pituitary is responsible for ovulation. At about day 14, the continued increase in estrogen stimulates the release of the luteinizing hormone from the anterior pituitary. The LH surge is responsible for ovulation or the release of the dominant follicle in preparation for conception, which occurs within the next 10 to 12 hours after the LH levels have peaked. That's actually part of health promotions and maintenance, which is 6 to 12% on the NCLEX. Lower section, but still very, very much important. All right. There are 8 client needs sections. Every single one of them are important, no matter how low of the percentage. In reality, the low percentage ones, you don't want to miss. You definitely don't want to miss the ones that are heavy hitters, like management of care and pharmacology and physiological adaptation, okay? Here we go. Question number 18. A client tells the nurse that she plans to use the rhythm method of birth control. All right, the nurse is aware that the success of the rhythm method depends on the what age of the client, frequency of intercourse, regularity of the menses, or range of the client's temperature. What are we thinking? What are we thinking? Shout out to all 64 of y'all. Shout out. Hey, if you're new here, welcome. Make sure you guys smash that like button, you guys share, and you guys follow. We're doing NCLEX questions, both for RNs and LPNs. I've had people come to tell me straight up, they're just like, these aren't NCLEX questions. I'm just like, so how many questions did you get on NCLEX? They were like 85. And I was like, so you didn't go through all 10,000 questions that 10,000 plus that the national board makes? So how do you know what's an NCLEX question and how do you know which one's not? Remember that NCLEX is a computer adaptive test. So if you start doing really, really bad, it's going to start giving you very, very easy questions like nursing school fundamentals types of questions. All right. But if you start doing very well, it's going to start giving you very hard questions. And that's where you want to be. All right. That is where you want to be. And the answer is C. All right. But the answer is C. All right. The regulatory of the menses. All right. The rhythm of, or the success of the rhythm method of birth control is dependent on the client's menses being regular. All right. Women are only fertile for a few days each month. All right. Women using the rhythm method monitor their baby and analyze their past menstrual cycles to try to determine when their fertile days are. All right. They are then either they either choose to not have sex during those days, or they can use a barrier form of birth control, such as a condom or spermicide. That's part of health promotions and maintenance. 6 to 12% on the NCLEX exam. Katie, you're telling me I'm at 20K? On my end, it says 18.6. I kid you not. 18.6. All right. So, hey, if you're not familiar with maternal newborn, if you're not familiar with women's health, if you're not familiar with pediatrics, anything that involves labor and delivery type, I recommend that you circle back. I actually had to learn a lot because obviously I'm a guy. I am a man. I am a male. And so I didn't know a lot about this. So, of course, nursing being 90% women, I had to lean on every single one of them. I was like, can you please tell me about this? And they're just like, oh, we got you. All right. Mine says, it says 20. Listen, ma'am, I got you. It definitely says, now it says 19. A client with diabetes asked the nurse for advice regarding methods of birth control. This is question 19. All right. Which method of birth control is most suitable for the client with diabetes? All right. Diabetes. All right. Is it the intrauterine device? Is it oral contraceptives, a diaphragm, or a contraceptive sponge? Hey, remember, if you've never heard of it, don't you ever pick it. Same thing with a select all that apply question. If you don't know, don't pick it. If you don't know, don't pick it. All right. You'll be like, so somebody tells me, what's a contraceptive sponge? No clue? You have no clue what a contraceptive sponge is? Like I said, if you don't know, don't pick it. Amos is telling me C. All right, well, let's see what the answer is. See what I did there? All right, here we go. And the answer indeed is C. It is a diaphragm. All right, the best method of birth control for the client with diabetes is the diaphragm. The diaphragm is a birth control contraceptive device that prevents sperm from entering the uterus. The diaphragm is a small, reusable rubber or silicone cup with a flexible rim that covers the cervix. Now, before sex, the diaphragm is inserted deep into the vagina. I'm sorry. So the part of the rim fits snugly behind the pelvic bone. I'm sorry, y'all. I'm immature. I'm so immature. And that is, I don't know why. The diaphragm is effective at preventing pregnancies only when used with spermicide. All right. Listen, Tweedledee, I'm sorry. I'm sorry. I'm sorry. I got to wake y'all up a little bit. You know what I'm saying? Health promotions and maintenance. All right. Health promotions and maintenance, which is 6 to 12% on the NCLEX. It says that's how they get us, finding difficult words they think we will pick. Exactly. Exactly. Like if you don't know and if you've never heard of it, get into the routine of not picking it. Get into the routine of not picking it. OK, because you're going to be like, you're going to sit here. Well, I think it's this, but I've never heard of that. Yeah, let me pick that. No, we don't want to do that. City girl. I'm sorry. I'm doing better. All right. Janilda, I don't know what you said. It kind of blocked it out, or you blocked it out. One of the two. All right, here we go. Question number 20. The doctor suspects that the client has an ectopic pregnancy. All right. Which symptom is consistent with the diagnosis of an ectopic pregnancy? All right. Is it painless vaginal bleeding, abdominal cramping, throbbing pain in the upper quadrant, or sudden stabbing pain in the lower quadrant? What do we think? What do we think it is? Shout out to all 63 of y'all. If you guys are new here, welcome. We're doing NCLEX questions. All right. Welcome to everybody. Well, except for Amos, but she always come in here and just do whatever she want anyway. Yeah, y'all. So what's the answer? What is the answer? Yes, yes, yes. Rose is back. What's the deal, Rose? What's up? The tubes. The tubes, man. The tubes. All right. Let us see. Let us see what the answer is. And 3, 2, and the answer is D. Sudden stabbing pain in the lower quadrant. Stabbing pain in the lower quadrant. Okay. The signs of an ectopic pregnancy are vague until the fallopian tube ruptures. All right. The client will complain of sudden stabbing pain in the lower quadrant that radiates down the leg or up into the chest. Patients presenting with vaginal bleeding would likely benefit from a pelvic exam to assess for infection, as well as access to cervical OS. Bimanual pelvic exams additionally allow for palpation of bilateral adexia to assess for any abdominal masses or structures, or to elicit adaxial tenderness. Physiological integrity, physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section. All right, third largest section, ladies and gentlemen. All right. Hey, by the way, I got coaching. If you're one of those individuals who needs help on NCLEX, I do coaching. All right. So you guys can go check that out. That link is in my bio, or you guys can just go over there to thebootnurse.com/coaching and fill out the questionnaire and come holla at me. Fill out the questionnaire and come holla at me, and I will hook it up. Y'all got me to 20,000 likes. Oh man, you guys are great. All right, I guess I'll do another one. Here we go. All right. I see y'all yelling at me. They're like, Kevin, no, why? All right, the nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant client? All right, think about it. Nutrition. All right, so here we go. Hamburger patties, green beans, French fries, and iced tea. Roast beef sandwich. I'm sorry. Potato chips, baked beans, and a cola. Baked chicken, fruit cups, potato salad, coleslaw, yogurt, and iced tea. Or a fish sandwich, gelatin with fruit, and coffee. What do we think it is? It's all healthy. Is it though? But think about it. We're talking about a pregnant woman, right? There's certain things that they don't want pregnant women to have. All right. So which one? Okay. So they're all healthy. Which one is the most healthy? How about that? All right. Not the cola. First of all, don't tell me what I can and can't drink. OK, the caffeine. Also, they're talking about the cola and the coffee. So they can't have B and they can't have D. OK, remember, if they give you multiple choices in an answer choice, if one of them is wrong, the whole answer is incorrect. All right. Now let's see what the answer is. Let us see what the answer is. And the answer indeed is C. All right. It is baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. All right. All of the choices are tasty. Well, some of them are, but the pregnant client needs a diet that is balanced and has increased amounts of calcium. This food contains meat, fruit, potato salad, and yogurt, which has about 360 milligrams of calcium. To maintain a healthy pregnancy, approximately 300 extra calories are needed each day. Really? I feel like this baby's just siphoning it out of y'all, man. You know what I'm saying? Like the babies are just like, give it to me. These calories should come from a balanced diet of protein, fruits, vegetables, and whole grains. Sweets and fats should be kept to a minimum. Health promotions and maintenance, 6 to 12% on the NCLEX exam. All right, 6 to 12%. All right, the largest section on the NCLEX is management of care. The largest percent on NCLEX is management of care, which is 15 to 21%, and LPNs, it is coordinated care, which is 18 to 23%. Regardless, they are still the largest sections. This is baked chicken is always right. Hey, when in doubt, pick chicken or baked fish. But like I said, if there's one answer that's in there that's incorrect, the whole answer is incorrect. All right. So question 22, a client with hyperemesis gravidarum is at risk for developing what? What are they at risk for developing? Respiratory or alkalosis without dehydration. Metabolic acidosis with dehydration. Is it respiratory acidosis without dehydration or metabolic alkalosis with dehydration? Everybody screaming D at me. All right. Everybody is screaming D at me. All right. Oh, somebody's telling me B. Mia is telling me B. Okay. Okay. Mia's telling me B. Raquel, thank you for joining. I see you in there. Hey, if you guys are just now joining, we're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Free sets of questions. You guys can go over there. You guys can check those out for yourself. Now, the answer is B. Now, hold up. Hold up. Mia's just like, yes. All right, now hold up. I know y'all are about to be like, Kevin. I'm like, first of all, I didn't write these questions. All right. That's number one. Number two is let us read the rationale. And this is why it's always very, very important. All right. The client with hyperemesis has persistent nausea and vomiting. With vomiting comes dehydration. When the client is dehydrated, she will have metabolic acidosis. In severe cases of hyperemesis, complications include vitamin deficiency, dehydration, and malnourishment or malnutrition. If not treated appropriately. Wernicke's encephalopathy causes a vitamin B1 deficiency, which can lead to death and persistent disability if not treated. All right. That is part of physiological adaptation. Hey, understanding this adaptation, remember we're talking about medical emergencies, chronic, acute issues, right? What's the other thing? Disease processes and how they affect the body. Okay. Disease processes and how they affect the body. All right. So if you didn't get this one, which I saw a bunch of you screaming D, all right, just circle back and read your rationales. Read your rationales. All right. Read your rationales. All right. And they will help. They will help tons. Trust and believe me. All right. They will help you tons. They help you retain. Read the rationales, help you retain. All right, question 23. A client tells the doctor that she is about 20 weeks pregnant. The most definitive sign of pregnancy. What is the most definitive sign of pregnancy? Elevated HCG, the persistence of a fetal heart tone, uterine enlargement, or breast enlargement and tenderness. Hey, how about this? How many definitive ways can you determine that a woman is pregnant? How many ways are there? Rosie, you got to give me one. A baby? Oh, a baby. Oh, I got you. 3. Okay. So name them for me. It says, Kevin, my man, 4 days until I find out results from my Anastasia. I have no doubt that you're going to rock it. The presence of the fetus. All right. So the presence of the fetal heart tone, right? The most definitive diagnosis of pregnancy is the presence of a fetal heart tone. All right. The signs and answers A, C, and D are subjective and might be related to other medical conditions. Fetal heart tone can be appreciated between 6 to 8 weeks of gestation. Between 8 to 10 weeks of gestation, important information about the pregnancy can be obtained by the provider, including placental location, fetal position and anatomy, amniotic fluid volume, and maternal anatomy, including dimensions of the cervix and uterus. That's part of health promotions and maintenance. 6 to 12% on the NCLEX, right? 6 to 12% on the NCLEX. All right. Very much important section. All right. Very much an important section. All right. So shout out to y'all for getting that right. Read your rationales, ladies and gentlemen. Read your rationales. Here we go. Question number 24. The nurse is caring for a neonate whose mother is diabetic. The nurse would expect the neonate to be what? Hypoglycemic, small for gestational age, hyperglycemic, large for gestational age, hypoglycemic, large for gestational age, or hyperglycemic, small for gestational age. What are we thinking? I have a baby bump and I'm not pregnant. Stop it. Stop it. Shout out to all 68 of y'all out here rocking. Y'all got me to 20,000 likes and I appreciate y'all. And now y'all are just tired. They're like, Kevin, I can't do no more. I'm just like, look, today's Friday. You know what I'm saying? Y'all could have been anywhere else, but y'all are here with me and I appreciate it. All right. So what do we think? We got B's, we got C's. It says B or C, but I'm going to guess C. Okay. It says B, I think. All right, Jenny. Amos telling me B. No one asked you. I mean, that's cool. I'm glad that you slid your answer in there. That's cool. Baby is going to be large. That baby going to be big. I'm right, though. Are you? Are you? No, you're not. See, look at you. Look at you. Embarrassed. Embarrassed yourself right now. Embarrassed yourself. Anyways, the answer is C. Okay. The I'm just playing. But shout out to you, Katie. Amos, we got to get better. Okay. The infant of a diabetic mother is usually large for gestational age. After birth, glucose levels fall rapidly due to the absence of glucose from the mother. Hypoglycemia is caused by hyperinsulinemia due to hyperplasia of fetal plus pancreatic beta cells consequent to maternal fetal hyperglycemia. Because the continuous supply of glucose is stopped after birth, the neonate develops hypoglycemia because of insufficient substrate, meaning that baby no longer gets what mom was given. All right, physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. All right, so shout out to y'all. Remember, when you guys, if you don't know this, circle back, get the content, make sure you read your question, read your answers, and you read your rationales. Okay, here we go. Question number 25. Which of the following instructions should be included in the nurse's teaching regarding oral contraceptives? All right. Weight gain should be reported to the physician. An alternate method of birth control is needed when taking antibiotics. If the client misses one or more pills, 2 pills should be taken per day for 1 week, or changes in the menstrual flow should be reported to the physician. What do we think it is? So we're giving instructions. All right. You want to know what's funny? I actually knew this answer and I heard it off Family Guy, believe it or not, a long time ago. All right. I got a bunch of people screaming B at me. Shout out to all 64 of y'all. Hey, if you guys are just now joining, we're doing NCLEX questions off of nurseslabs.com, both for RNs and LPNs. You guys can go over there and check those out for yourself. All right. A little bit about me. My name is Kevin. I'm a registered nurse. I worked ICU, OR, and PACU. I'm a BSN if that really matters to you. I was in the Navy for 16 years. I got out in January. I failed my NCLEX 3 times. I passed on the 4th. No one at my job knew that I failed NCLEX until I told them. And that was like 3 years after that. And they were like, wait, are you serious? I was like, yeah. They were like, I would have never guessed that. Because guess what? Don't nobody care. They don't care. And neither should you. Family Guy is my 28-year-old son. Even not listen. Family Guy is great. I don't care what nobody says. But the answer is B. An alternate method of birth control is needed when taking antibiotics. All right. Future RN in Massachusetts. Shout out to you. Shout out to you. Kevin can talk. I can talk. I've been an instructor for like 10 years, so you have to know how to communicate. All right. When the client is taking oral contraceptives and begins antibiotics, another method of birth control should be used. Antibiotics decrease the effectiveness of oral contraceptives. Antibiotics are suspected to diminish oral contraceptive efficacy by 2 main mechanisms. The induction of the cytochrome P450 group of hepatic microsomal enzymes and interference of the enterohepatic cycle of whatever that E word is, E17. We're going to say that. I don't care about saying it. Y'all already know what it is. 6 to 12% on the NCLEX. All right. 6 to 12% on the NCLEX. LPNs, you learn the same content. Kia says, I want to join the Navy after I finish school. Join it. Join the Navy. The Navy right now, they're taking the BSN graduates right out of school. All right. They're taking BSN graduates right out of school. All right. So shout out to y'all for doing your thing. And that, ladies and gentlemen, is our questions. I'm trying for the Air Force. Go for the Air Force. Go do your thing. It says, I pass. Hold on. Is it Zio? Says, I passed my NCLEX May 14th. Thanks to you. Hey, first of all, Zio. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here, man, what would it be? And of course, congratulations to you. Everybody that's in here needs to give Zio some love right now. All right. So what would be that advice? What would be that advice that you would give to people? What about the Congo? I've never been there. Never been to the Congo. I've seen the movie. Let me see what else you said. Amos, you can go Air Force too. I know that they take brand new nurses out of the Air Force or in the Air Force. The Army the Army, Air Force, and Marine, the Army, Air Force, and Navy all take nurses. I can't. Congratulations. Oh, okay. Hey, but shout out and congratulations to all y'all. Let's see what Zio got to say. Zio, I'm so glad that you were able to do your thing. You're welcome, Mia. No problem. You guys are very welcome. Hey, but like I said, I appreciate you guys hanging out with me today. I appreciate the participation. Y'all got me to 22,000 likes. I can't be any happier about that. Although gifts are greatly appreciated, they are not recommended. So I do appreciate that. I didn't have to ban anybody. I'm a little sad about that. I'm usually petty, so I like to ban people, but I didn't. So lucky them. Once again, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and you guys can check those out for yourself. Hey, if you need an NCLEX review, I have an NCLEX review. I have actually 2 NCLEX reviews inside of my course. All right. I have an NCLEX review where I break down all 8 client needs sections. And I have another NCLEX review that's almost 4 hours long where I go through like 100 questions. All right. You guys can check that link out right there, or you can go to where it says thebootnurse.com/special, or that link is in my bio, in my link tree. All right. And it's labeled 7-day NCLEX course, and you get it forever. So you have it for a lifetime. Right now it's 70% off. It usually goes for $397, and now it's going for $97 because I want everybody to be able to get it, and you get all the updates to it. Make sure you guys go over there, get that free download. All right. Make sure you guys go over there and get that free download. All right. And check out everything I got going on. Make sure I was on a podcast this week or like 2 months ago, and it just got posted. Go check that out. I'm going to be posting that too. So I want you guys to go over there and check that out for yourself. You're welcome. Is it Aaliyah? Aaliyah, I ain't seen your name. I ain't seen you not once in here. And so you mean to tell me you were lurking? That's not nice. Zio says prioritization, psych basics, and case study practice will definitely help you pass. I used Archer. Love it. So you used Archer. Yeah. See, you didn't think I noticed that, huh, Aaliyah? That's all good, though. I'm glad that you were here, and I'm glad that you got some knowledge. All right, Kia. No, you're the best. I appreciate you being here. All right. Hey, but make sure you guys show up on Monday because I got some stuff I'm working on that I'm going to be talking about it on Monday. So make sure you guys are here. Queen, you are welcome. But like I said, if you guys have any questions, check out the links in my bio. Janilda, you have a great weekend as well. What time? Same time. Monday, Wednesday, Fridays at 5:30. Same time. All right. But everybody have a really good weekend. I'll see everybody on Monday. My fat finger up here. All right. Bye.